Hi there. This video is to demonstrate the new proactive med review checks process that we've developed. The idea of this is to kind of replicate a bit more what we realized pharmacists are often doing, which is that they are looking around the notes, trying to see what things our system has picked up. If you want to access this proactive med review check, if you've got the prescribing overview view on your clinical tree, then it's available at the top with this icon. It is available within the prescribing overview here, although I suspect it'll be quite slow running it from in here because protocols are a lot slower when they're doing that. Or if you're going to be using it a lot, you could put it on your toolbar like I have. What it's trying to do is run through all the sorts of things that our system might be picking up that need to be considered for a patient. And it's trying to help you manage those outcomes, and then it offers you the chance to say, do you want to do a notes-based review? I'm going to show you how it works on a couple of test patients. Because they're test patients, we've put lots of things going on there. I think on most patients, you won't find it flags up nearly as much, but hopefully it's helpful. So if I launch it here, first thing that it has found, and this is picking up an outcome from our pathology system. So what a lot of practices are doing and finding at times is that you might be working off one report to do some work for a patient, and then in the process you realize there's other things that need happening. Or in some cases, people are going in and out of the same record multiple times. So the idea of using this is it's going to flag up these things as you go through it. So it may well be you want to click yes, and then you follow that protocol, go ahead, it brings up the calciferol warnings, I proceed, it prescribes the medication, it generates the message to the patient, it documents it all, and it asks me if I want to arrange the monitoring. So let's say I'm going to do all of that. Next is flagged up compliance issues. Test patients are often poor with their compliance. You've got options here. So for example, it might be that I say, well, I want to pop out the repeats, and that brings up a different screen, and I can see here what's going on. And from this screen, I can potentially stop medication or do whatever it is I need to do. If I ignore it, that's fine. But if I do record it, say as appropriate compliance, that means that if I come to use the med review check, that bit's already done. So now it's telling me there's nothing else going on that's identified. Do I want to do a notes-based review now? If I put yes, it will then do the same normal checks, but it will skip anything that's already been done and picked up. Do I want to inform the patient? Let's say yes, automatically. Move the review dates on. Okay, so if I put do now, that takes me to the repeat template screen where I would do that. And I can use the number 7 if I don't want to reauthorize. I just want to move the review dates on a year. Or let's be doing it properly. So 31st of January, because that's the last day of the birth month, 2027. And yeah, that's it done. So the idea is that that prompt has flagged up anything else. It's going to help me manage the things it flags up. It might be, though, that it's just something to kind of prompt you, and you might want to come out of that and look at it differently. I'll show you on another test patient how we've done this. This one's got a bit more going on. So first of all, there are medications, questionnaires, or instructions that need to be actioned. If I click review, it will show me more information, and then I can decide whether I've discussed them or not. Or again, it may not be that I'm necessarily discussing now because I'm just doing a notes-based review, but at the very least, I can consider whether that still is needed or not. So I can see the kind of previous things, discuss beta blocker related to heart failure, and the patients asked for some discussions themselves. So I might put no longer needed, or for now, we'll just say no, I've not done those things. This is a new safety alert we've developed. Their EGFR is 27. I might say, let's look at the information. Okay, I can see that it's been low before, but it's dropped a bit more now. So let's say I'm going to repeat the UNE. So that will take them off that alert until that UNE is repeated. If the EGFR has gone above 30, great. If it hasn't, then I need to review that again. And no, we'll leave that for bulk invites. Next, there's some monitoring that's due, and they might be under secondary care. Are they under secondary care for all these things? Go into info and so on. Let's say not for all drugs. Therefore, this is directing me to call the patient. If you're a GP working through this, the information will be a bit different, and it might suggest reducing access to that medication. For now, I'm going to click pause and move to that. Again, it's picked up the compliance. I'm getting bored now, so I'm going to click ignore. Secondary care, let's say no, they're no longer under secondary care. Like I said, there's a lot for this patient. Quaff alerts. So here's that beta blocker one for heart failure. The only ones that should appear here are the things where we've not already been able to sort of do those steps and then close. Do I want to do a notes-based review? No, because it may well be after all of those things I think, yeah, the patient still needs an appointment. In fact, perhaps that would be a good option to have on that final screen, because it may be that going through that process, actually, we think that. So I'm going to feed that back, and we might take that away and develop that. I'll see what our lead pharmacist thinks. Try it on patients. Some of the time it won't flag up anything at all. If there are things that you think it should have flagged that, but it hasn't, let us know. But generally, it's just working with all the other bits of our system that are there and trying to make it slightly more streamlined, at least, in how you manage all those outcomes. Thanks.